the new Maha Commission report, we have Mike Leon, NTD News contributor and host of the Can We Please Talk podcast, and Tony Kinnett, national correspondent at the Daily Signal and host of Tony Kinnett Cast radio show and podcast. So first of all, good to see you guys. So Mike, I'll start with you. I took a brief look at the latest report that is released by the Maha Commission. Dietary guidelines for Americans are being updated to align with more of the latest science, and this is aiming to prevent and reverse chronic childhood diseases. What are your initial thoughts on this? What do you think of the strategy?
Yeah, well, first of all, good to see everybody. Nice little background there, Tony. I love seeing that. Look, I agree with a lot of what RFK wants to do with respect to making America healthy again. As always, and this is like a sports analogy, Don, right? Like you could agree with the game plan, but then as you start playing the game, you see the execution, you go, I wouldn't have done this, I wouldn't have done that. In this report, for example, right? And it's a 20-page report that's been released by them. They talk about some of the ways to tackle, whether it be dyes in foods and, making America healthy again in terms of exercise and the information around that. I look at it this way, though. The NIH study that happened in 2017, Don, that had a direct correlation between low income and food quality, being able to afford better quality of food, having education and training about why you should be eating better. And that is me, just as a human being. I grew up in the Bronx. I grew up in an area where in a 2-3 mile radius, there was foods in high trans fats that were being sold because it was cheaper than buying produce, fresh produce, or farmers markets, which were 30, 40 minutes north in New York. If we're really going to tackle childhood obesity, diabetes, some of these other issues that we have with respect to chronic diseases, we have to tackle the root causes of this. And that's income inequality, and that's information and how people understand why it is important for you to eat healthier, even though it may be more expensive. And so if we don't tackle that, and this report outlines a bunch of steps, which by the way, previous administrations have already tried to do as well. So I don't want to make it sound like they're shattering, or breaking new ground here in terms of details on that. But if we truly want to tackle that, we have to look at all of the surrounding factors of why there is being led to chronic diseases, including previous studies that were done by NIH around this specific topic.
All right, Tony, I understand you just have a few minutes to talk to us today. Let's see if we can get in at least one question here, maybe two, and then I'll talk to Mike by himself today. So I'm going to assume that you agree with the overall game plan as well as Mike mentioned earlier. Are there some specifics within that that you agree more with and some that you agree less with?
I'm going to take the really outland approach here as I'm traveling today and say, actually, I really can't stand the majority of this. And the reason I can't stand the majority of this is that the government has consistently made horrible calls regarding health and nutrition for the last 50 years. I will remind you guys that in the 90s, the big food pyramid that was pushed by the agricultural industry and the USDA said that we should all be eating 6 to 12 servings of bread per meal. And that's ridiculous. That's calorie city. And it's some of the things that led to the high trans fats food that that Mike was talking about earlier on, the kind of 70s and 80s kind of food deserts that expanded in a lot of cities were encouraged by some of the fight against crime and kind of the inner city revitalizations that ended up turning on their heads. The government getting involved in scientific studies. Look, as a former science teacher, as a guy who was trying to teach my students about nutrition and biology, anatomy and physiology, the last place I would turn for answers is from the US government. I like what RFK Jr. is trying to do here. I think his motives are pure, but then he gets out and he says wackadoodle crazy stuff that doesn't help anyone. And then he'll say 8 or 9 things that are excellent. I think him pointing attention to pregnant mothers taking Tylenol, leading to a higher risk of mental crises or mental illnesses that children or deficiencies in mental development earlier on in the womb. That's a serious concern. And I like seeing that kind of a red flag. Hey, what's going on here? Taking unnecessary food dyes out of foods. Excellent. I'm all for it. But pretending that's going to be the panacea that fixes the health crisis in our country is like suggesting that me bringing a wine cork to a failing dam is going to save the valley from a flood.
Well, all right, Tony, I think that's about time for you. If you feel like you need to log out now, feel free to do so. It's been great talking to you today.
I'm sorry, I do have to scoot, but you guys have an excellent conversation. Mike, take it home.
Thank you.
All right. So, Mike, can I get your response on what Tony just said now? What do you think about the overall situation here about the Maha movement?
Well,
No
look,
problem. I understand.
Tony's
Thanks, guys.
Well, look, Tony's absolutely right, Don. You know, there's a couple things in the report that are in diametric opposition to each other. So, for example, it talks about clean air and analyzing clean air. Well, President Trump just made cuts to the EPA, and their proposed fiscal budget would reduce it by $5 billion in 2026. So do we want to look at the air quality, or why would we make reductions to the Environmental Protection Agency? So that's number one. I agree with Tony's overarching premise about trusting the government with respect to getting involved in food and nutrition services. If we look at the One Big Beautiful Bill, for example, and we look at this Maha report, there's a couple of other areas where they're diametrically opposed to each other. This report outlines mental health services, right? Well, the One Big Beautiful Bill, which would go into effect in 2027, makes cuts at the Medicaid and Medicare level where people take advantage of that for mental health services, including the Milbank Foundation has said, and this is a popular foundation in New York, that has said this will critically undermine some of the work in the mental health services department. So, you know, I agree with what Tony's saying about RFK overall. Like, he'll say 11 things that I couldn't disagree with more. And again, I'm a parent of a daughter who's on the spectrum. I have an atypical daughter and a typical daughter. I don't agree with RFK on anything he says about vaccinations because he has no degree in molecular biology, epidemiology, virology. Neither do I. You know who does, Don? The doctors that I'm friends with that are scientists. My co-host Nick Savary is married to the head of a pediatric ICU at a major hospital in Pennsylvania. I trust those folks to disseminate information about vaccines, and there is no direct link to autism. But if there was one, I would trust those people with that information. At the same time, that doesn't mean that I don't agree with RFK about taking out, you know, dyes in foods and making sure that people have the right information about why they should be eating healthy. So that information is readily available. It's accessible. There's no bureaucracy and red tape when people are trying to take advantage of services or get this information. But we have to tackle all of the issues, which is that people that don't make that much money don't have that much money to spend on fresh produce. So they go to the McDonald's and Taco Bells and Wendy's of the world, unfortunately. And those foods used to be higher in trans fats, but they're fried foods and they're processed foods. And unfortunately, that's what leads to this evolving epidemic that we have, especially in low income areas.
So can you put into perspective everything you're saying, Mike? How does the current Trump administration's focus on health compared to previous or prior administrations?
Yeah, that's a good question. And that was something that I did analysis-wise when looking at this report and kind of looking back at during Javier Becerra's term. I think RFK has made clear, and what he said last week on the Capitol Hill testimony is that he feels like the scientific establishment is corrupt. If you remember, him and Bernie Sanders kind of had a back and forth about that. He's not talking so much about established science, although I would argue he does with respect to vaccines and autism, but he's talking more about the scientific establishment. He feels like there has been corruption in there from these organizations in terms of whether it be funneling money to that way change the narrative and information. And he wants to change that people are reactive instead of proactive. Proactive would mean leading a healthier lifestyle, nutrition, fitness, etc., versus reactive, which is, well, now I'm sick. Now I need those medicines to make me better. And you're now relying on that, a cycle of recidivism of getting medicines to help you. I agree with that framing. Again, the problem is the person who's in charge of it. How does that differ from the Biden administration or even administrations previous? I mean, Michelle Obama ran something similar like this, and we saw a lot of people up in arms with some of the rhetoric behind Michelle Obama wanting to, you know, have government intervention and control in what foods you can and can't have or choose to ingest or not ingest. So you haven't seen, I mean, you're going to see pushback again, I think, at the level that I'm bringing it down, which is the person disseminating that information. Because even some doctors and scientists from major research universities have recently said, look, I don't agree with RFK on anything vaccination-wise, but he is right about this. And why haven't we talked about XYZ? Back to what Tony was mentioning on pregnancies with women. So there are certain things, it's just it's the messenger that's delivering it. And now I have to trust that all that information is on the up and up when I just mentioned to you the medical qualifications for that person leading the agency is not there.
Can you talk to us about how you feel RFK Jr. is tackling, having healthy food in grocery stores, being more of informing of Americans of the kind of food that they're eating? How do you feel his efforts on that is?
Yeah, again, another good question, because I think, first off, if you go to the grocery store and you read the side labels of processed foods, let's just take cereal as an example. I did this exercise about 20 minutes ago, Don, when I was eating some Honey Nut Cheerios. You just read the caloric intake and then you read what's made up of it, right? Whether it be proteins, total sugars. But the problem is that, again, I'm not a nutritionist. Neither are you, Don, right? So what do? We rely on experts in those fields to tell us more about what is being presented in this label and what is being packaged in this food, and is it safe enough to give to my kids? I think he has the right intentions with respect to that in terms of giving that information and making it more front-facing and available, and kind of explaining these big terms, making it more rudimentary for people to understand. Again, that's not the issue. The issue is the other things. There are other things that are antithetical to what the Trump administration has cut funding-wise. And I think there's going to be a push and pull here between what RFK has released in this agenda that's going to either rub up against, or, he's going to have to knock on the president's door and say, hey, can I get 15 minutes? Because we need to talk about some of the things that are in this report that we want to accomplish, because unfortunately, with the one big beautiful bill passing and some other potential executive orders, they're not in line with some of the things that are in the report. So again, look, this is not new in terms of presenting information to people. It's really about, if we truly want to tackle these things at the highest level, Don, there are surrounding mitigating factors about something. So for example, in the example I gave earlier, when I grew up in that neighborhood, that in a 2-mile radius is a lot of foods sold in high trans fats, and the income wage there was around $40,000 a year. And then you move 45 minutes north and the income wage is about $100,000 a year. And there's more grocery stores and farmer markets in there. We have to tackle those issues, because that's the difference between urban areas and suburban areas. And so if we're going to tackle that, we have to tackle it with the ability for people to afford that food. Make sure that we're not, making everything, Wendy's and the Taco Bell and all of these processed places, but then also give these people the right information and tools to be able to download that information and then, make the decision about what they want to feed their kids.
I mean, I don't know, Mike, isn't fresh produce cheaper than those processed foods and fried foods like Wendy's and McDonald's?
Oh, Don, you fed into my answer for this beautifully, buddy. I'm telling you, in 2017, I want people to go check this out. In 2017, there's a study from NIH. It's readily available on their website. You can go read it. And it talks about what I'm mentioning in terms of the correlation between income inequality and, having a healthier lifestyle and diet, right? And while there is no true special relationship, there are some corollaries. And within there, they talk about what the average salary and what the average monthly spend is on people who buy fresh produce versus people who would, like, let's say, for example, when McDonald's had the, dollar snack wrap or whatever it was, and they offer value fries, all of these companies offer that stuff, and how much an average meal was on a spend for a week versus buying produce. And so, now again, this is 2017. This is not accounting for inflation. So we can't take any of those. Well, let's just do apples to apples. And it was markedly maybe $10 to $12 more expensive to buy fresh produce if you lived in a low income area versus, like I mentioned before, about me moving 40 minutes north and people with a higher median average salary. And that was around $76 for a family. So in terms of monthly spend on fresh produce, okay? So it is a little bit more expensive to buy fresher groceries. But back to your point, Don, right? First off, processed foods taste better, right? Freedom of choice and expression. If I want to eat that, I should be able to eat that, right? This is America, land of the free, home of the brave, right, Don? So you're battling that already, but also what RFK I think is trying to present is we need to make everything front facing. all the information front facing, and we need to figure out how we lower the prices of produce, fresh fruits, and get it into the, into the hands of folks in these areas. Look at what Zoran Mamdani wants to do in New York with these grocery store ideas in terms of, a pilot program and one in each borough. If he were to succeed, let's say he becomes mayor and he's leading the race right now, he becomes mayor and he wants to do this pilot program. Does that mean the government is controlling the prices of the produce versus other, inventory that will come into those, like a General Mills and all those processed foods that come in there? Are we going to make it cheaper there? There's a perfect example of, will the government control the prices over, these corporations that are putting in all of their products into these supermarket chains? So we'll see a little bit of this potentially play out in one of the biggest cities here in our union.
Okay.
As it is not inexpensive to buy produce. It's just, it is cheaper to buy processed foods based on that 2017 study that NIH did.
Okay, sure. I'm not going to argue against the data, but I mean, from my personal experience, I feel like it's more worthwhile for me, at least personally. It's better to buy fresh produce. Yeah.
Yeah.
Okay. Well, good discussion today, Mike. Too bad Tony couldn't be here for the most of it, but it was good anyways. Thank you very much.
Yeah. Thank you, Don.